Thank you, and good afternoon. Ambassador Lang, fellow panelists, colleagues. Let me start with thanks and apologies. Thanks to the organizers and the National Academy of Sciences for inviting the U.S. Agency for International Development, USAID, to participate today, and regrets on behalf of the Bureau for Global Health Senior Deputy Assistant Administrator, Elaine Cook, whom I know looked forward to joining you today. She asked me to come and deliver her remarks on her behalf, given the priority that USAID's Bureau for Global Health places on the theme of today's session, which converges fully with Administrator Mark Green's vision for the agency and resonates so strongly with our work in the Bureau for Global Health. For more than 5 decades, USAID has worked with country governments to meet the health needs of women and children and men. As a development agency, USAID aims to build capacity and reduce the disease burden while strengthening health systems to enable countries to better plan, fund, and manage their own continued progress. We seek to build sustainable and resilient health systems in many of the poorest countries of the world. I think it's clear that many of the points of my remarks have been made earlier and will echo some of the themes that were presented. But turning specifically to transitions, since 2000, the Bureau for Global Health has engaged in strategic and deliberate processes to assess transition readiness in many of the countries where we work. We established a precedent within the agency on how such processes should occur and continue to share our lessons learned. A key illustration, which began in 2006, has been graduating countries from family planning assistance. We did this with a clear set of quantitative and technical criteria. In the 2000s, USAID implemented a carefully planned, data-informed approach to transitioning a number of Latin American countries from USAID family planning assistance. Factors we considered included the total fertility rate and the modern contraceptive prevalence rate, an outcome-based approach. We conducted a consultative assessment to determine remaining weaknesses and gaps in the family planning programs and set timelines for program graduation. Objective and quantitative data were used in a collaborative process with host country governments and other stakeholders. The overall programmatic goal of the process was to achieve access, quality, and sustainability. The family planning graduation process normally lasted, on average, 4 to 6 years, with some exceptions. Having such time available for planning and extensive, in-depth consultative engagement represented a key element for success, and I think some of the earlier panel speakers touched on this priority as well. Communication is fundamental to the process of transition or graduation of a host country. Building a new type of relationship or partnership requires trust and mutual understanding. If the transition process has been done in consultation with all relevant stakeholders and has been transparent, it will not come as a surprise. Managing communication successfully throughout the transition process is a critical requirement. I should also note that we do continue to track whether host governments channel resources to poor or hard-to-reach communities after withdrawal of our assistance. This reflects one reason as well why we partner with civil society, which was also underscored in earlier presentations, to ensure they continue to advocate for the poor. Our communication also includes that with non-health, for instance, planning and finance, parts of the governments, as well as with the non-governmental sector, and of course also within the U.S. government interagency to ensure policy coherence. In another illustration, beginning in 2008, USAID phased out global health funding in 26 countries to strategically focus our efforts on preventing maternal and child deaths. This is one of our priorities, one of our 3 goals, including controlling the HIV/AIDS epidemic, and again, thanks to Ambassador Birx for her exceptional leadership, preventing maternal and child deaths, and combating infectious disease threats. And of course, health system strengthening is an underlying foundational component across the whole strategy. The 25 priority countries for preventing maternal and child deaths were selected on the basis of several criteria. 1, highest need; 2, demonstrable commitment to achieving sustainable health impacts; and 3, the greatest potential to leverage U.S. government programs and platforms. A range of different indicators and processes were used. Even today, we continue to revise and refine our transition process, including, for instance, looking at broader health system aspects. Countries need to develop, lead, fund, and sustain a prioritized strategy for reproductive, maternal, newborn, and child health that includes sustainable financing efforts, policies, and commitment to evidence-based interventions that improve populations' health. I'd like to emphasize that for USAID, the term strategic transitions does not necessarily imply that we're ending programs, but that it is evolving really to a new model of partnerships. In most countries where USAID graduated programs from family planning assistance, a highly productive and valued partnership was built between USAID technical staff and local partners. This relationship did not end with the family planning and reproductive health assistance. Ways to continue the relationship were developed as part of the graduation plan. These might include communities of practice, south-to-south learning, and working through regional arms of global fora. Transitioning does not mean that we no longer invest in the health priorities of our partner countries. It means that the nature of our partnership evolves and that we will do some things jointly or in partnership with a variety of players, including the private sector. We may also facilitate new types of partnerships that bring in funding from different sources to meet priority goals. One innovative approach along those lines has been USAID's work with the Global Financing Facility in support of Every Woman, Every Child, which Tim Evans also mentioned during his presentation. The GFF has expanded from an initial round of 4 countries to a total of 26 in November of 2017. USAID has investments in 25 of the 26 GFF countries and engages with the GFF at country and global levels. I'm going to skip an illustration I had in the interest of time, but I really wanted to touch on private sector engagement, which is another key theme of today's session and tomorrow as well. Successful private sector engagement in global health can increase impact, use USAID resources strategically, and build sustainability in programs to support countries as they transition from donor assistance. Increasing private sector engagement, another priority for Administrator Green, is a means to an end and not an end in and of itself. So it is important to understand the types of outcomes we aim for through this approach. Private sector engagement can significantly contribute to 4 global health impacts: greater scale, higher efficiency, more value for money, and enhanced sustainability. To ensure successful partnerships with the private sector, USAID recently developed a global health private sector engagement strategy. With this strategy, we hope to best leverage private sector resources and incentivize their engagement to support countries in their path to self-reliance, and so that one day our donor assistance is no longer needed. Of course, our partnership with other bilateral donors, such as JICA, foundations, and global entities continues to reinforce our work with the private sector. Each country's health journey is unique. Different interventions that aim to reduce maternal and child mortality also experience shifts at different times, and countries take different paths during the course of their journey. Political prioritization, stability, and unforeseen natural man-made disasters can all change or interrupt a country's journey to self-reliance. We need to continue monitoring risks and threats to our investments, whether political instability or virulent pathogens spreading and threatening lives. Investing in leadership development is one aspect of building resilience in country health systems. When Zika hit Latin America and the Caribbean in 2006, USAID had maintained relationships in the countries where we had previously graduated out of health programs. Those relationships and enduring ties provided a crucial entree as we worked to mobilize an emergency response. Finally, to conclude, on June 19th, USAID will release the 2018 Acting on the Call Preventing Maternal and Child Death report. This year's report is focused on the journey to self-reliance for the 25 priority countries I mentioned, and includes relative measurements of where each is in its respective journey. I'd also suggest that today the agency had a public session to announce its new metrics for the journey to self-reliance, and they're now also available on the USAID website for those who are interested in looking more at where we are headed with this process and looking at transition longer term. Thank you.